My brand names are apopentoxifilin, Nutrin, Pentoxil.
My brand names are Pentoxifilin, Pentoxifilin SR, and Trento.
My chemical name is 37-dimethyl-1,5-oxohexyl purine 2,6-dione. Pregnancy category is I am at pregnancy category C, wherein animal studies failed to reveal evidence of teratogenicity. There are no control data in human pregnancy. It is only recommended for use during pregnancy when benefit outweighs the risk.
Me and my metabolites decrease blood viscosity and improve the blood flow and peripheral tissue oxygenation. I increase red blood cell flexibility by increasing erythrocyte ATP and cyclic nucleotide levels, and reduces the viscosity of blood by decreasing erythrocyte aggregation and stimulating fibrinolysis to reduce plasma fibrinogen concentration. All these effects enhance the ability of blood to flow to peripheral vessels. I am a phosphodiesterase inhibitor. By blocking the membrane-bound phosphodiesterase, it increases the concentration of cyclic AMP. It also inhibits thromboxane synthesis and increases prostacyclin synthesis. This action results in reduced platelet aggregation. Further, in patients with circulatory disorder, I have demonstrated increased adhesion of platelets to the vessel wall.
Exert vasodilation in the skeletal muscle vascular bed by inhibition of PDE and increasing the CAMP. I inhibit the leukocyte-derived free radicals during peripheral ischemia in patients with peripheral vascular disease, and it is shown to reduce the impairment of filterability rate of unfractioned leukocytes, limiting the ischemia-related tissue damage. I had immunomodulatory effects that improves leukocyte deformability and chemotaxis, depresses neutrophil degranulation, decreases endothelial leukocyte adhesion, and lowers the sensitivity of leukocyte to cytokines. Besides, I can inhibit the production of inflammatory cytokines, and I am also an antagonist at adenosine 2 receptors. I am indicated to those with intermittent claudication associated with peripheral vascular disease, Behçet's syndrome, prophylaxis of acute claudication due to sickle cell disease, neuropathic pain secondary to diabetic neuropathy, Kawasaki disease to reduce the incidence of coronary artery lesions.
Contraindication. I am contraindicated to bleeding, intracranial bleeding, peptic ulcer disease, retinal bleeding, surgery, renal failure, renal impairment, geriatric, acute myocardial infarction.
My side and adverse effects are in the CNS or central nervous system includes agitation, dizziness, drowsiness, headache, insomnia, nervousness, tremor, anxiety, confusion, and malaise. In the CV or cardiovascular includes angina, edema, hypotension, and arrhythmias. In the ENT or eyes, ears, nose, and throat includes blurred vision, epistaxis, laryngitis, nasal congestion, and sore throat. In the GI or gastrointestinal includes nausea, vomiting, constipation, diarrhea, abdominal discomfort, belching, bloating, dyspepsia, flatus, cholecystitis, dry mouth, excessive salivation, and anorexia.
My side and adverse effects: in hematologic, I may cause leukopenia. In respiratory, I may cause dyspnea. In skin, I may cause rash, urticaria, pruritus, brittle fingernails, flushing, angioedema. Other side and adverse effect, I may cause bad days, weight changes, thirst, flu-like symptoms, and lymphadenopathy.
Nursing responsibilities. Assessment. Before taking me, first is monitor blood pressure, respiration in patient taking antihypertensive, assess for intermittent claudication baseline during treatment, and monitor blood tests, ProTime HGB, HCT in patient risk of hemorrhage.
During the administration of the drug, the nurse should have patient teaching. Instruct the patient to take the meals and to swallow tablets without crushing, breaking, or chewing. Inform the patient that the drug can cause adverse effects. Instruct the patient to report chest pain, swelling, and flu-like symptoms. Tell the patient that smoking may make drug less effective and that many over-the-counter preparation increase risk of bleeding. Review all other significant and life-threatening adverse reactions and interactions, especially those related to the drugs, herbs, and behavior mentioned.
In evaluation, it includes the positive therapeutic outcome, which are decreased pain and cramping and increased ambulation.